everyone, welcome to my channel. My name is Francia. Today I'm going to be talking about 5 things I wish I knew before graduating nursing school. Now before we get started, please feel free to like, comment, and subscribe. The first thing I wish I knew was when to start studying for the boards. I waited until I got clearance to test to start studying. I think I studied for about 2 or 3 weeks, give or take. When I went to take the test, I felt okay, but I felt like if I studied for a little longer, I would have been a bit more comfortable. I mean, it is the NCLEX. You could never be comfortable. You will always be anxious and have lots of anxiety regardless of how long you study for. But what I found out that would have been very helpful for me, most people, well, a few people done it, they studied throughout all the last semester in nursing school. It's about 4 months every semester for my school, so at the beginning of the 4-month increments, you start studying. Now, I'm not saying study every day because you do have your classes, clinicals, preceptorship, and homework. Don't forget the ATIs. So I would say take about an hour out of every other day to study and do about 20 practice questions and stuff like that. And when you get clearance for testing after you register and do all of that good stuff, you may dedicate a specific time to really brush up on the material and kind of like fix and polish everything that needs to be polished. The second thing I wish I knew was when to start applying for jobs. I live in a South Florida area. Now it takes a new grad approximately 4 to 6 months before you find a job. Now there's jobs out there. I know there's some sayings that as a nurse you never go without a job. The job markets are always opening, people are always sick. That is true. But as a new grad with no experience, I'm speaking mainly for the people with no experience, and it does apply to people with experience in the clinical healthcare field as well. But this mainly applied to me as a completely new nurse with no experience. The problem I ran into was the rejection. A lot of people reject no grads. You would go on the site and it would say in bold print, no new grad at this time, or experienced nurse only. And if it says experienced nurses, trust me, they will overlook your application a lot of the time and don't give it the time of the day, and you're gonna possibly wait for like a good Lord knows how many amount of time for a callback, and you will never get one. Now, what I recommend for you to do is start applying at the beginning of your last semester. When you start applying for these jobs, it does give you the option to click, are you already licensed, about to take the license in 30 days, or so forth and so on. I think the max I've seen is about 30 to 60 days. So I think 2 months into your last semester, that's when you should start applying. Now apply every day. Keep applying. Eventually it will start calling you back and you will start to see, apply every day. Eventually it will call you back. Now, the third thing I definitely want to say is piggybacking off number 2 is how to prepare yourself for job interviews. Going to nursing interview isn't like most interviews that you went to get like a regular prior nursing job, I want to say. You definitely have to do your research about the floor. You definitely have to do research about the hospital. You have to come well prepared because you are competing with 100, if not more, applicant that's probably more qualified than you and that are applying for the same position. You definitely have to be prepared, dressed to impress, and of course sell yourself wonderfully, have a wonderful smile, and be very open and make them love you and want to hire you. You got to sell yourself. Nobody wants a nurse that's nervous and not sure if they are capable of getting a job. Once you prove yourself, then you can prove yourself any. Number 4 is, again, related to number 2 and 3, is about your resume. Now your resume, my school does have, I guess, a program or a specific department that help you with building your resume, and that applies specifically in your career field. You can't just use any resume template as a new grad. It has to be specific layout that it had to be in, where it's like your clinical experience have to be listed, especially if you have 0 experience. Your If you join any club, it has to be listed. You have to really show credit to yourself. It's just a very different layout that I'm used to. So I'm pretty sure most people might have known this, but this is news to me. So definitely kind of work on your resume throughout nursing school. Every semester, add your clinical location and how much hours you did. That's very important. And which floor was it on. There's templates that you find in Google that would help you out, but my school did help me a lot about building it, so I didn't really do much work. And that, because I went to a job fair and they actually kind of questioned the woman or the young lady about, you know, I don't see where it's listed that you did your clinicals, or you affiliate with any other hospitals, blah, blah, blah. So it's kind of very important that you show them that you have stepped foot in this area or that area, especially if you're trying to go into the hospital setting. The last and final point that I want to share, and I feel like this is the holy grail, I saved the best for last. This right here is about, I believe, the most efficient way for you to get a job. Job fairs. Tip number 5, job fair. Job fair. Also known as, what is the best place for me to apply and able to get a job? Job fair. Like, job fairs are just a very big opportunity you will get. There's multiple hospitals that's usually there, multiple unit, multiple hiring manager, multiple DON. You may not like this one, you talk to this one, you link up with a lot of people. Job expos, job fairs, career fairs. Your school might have some. Hospitals definitely will have some every certain time period. That right there, you have to get involved. That is the quickest way for you to get your booty into that hospital or that unit or that facility you're trying to get into. Job fairs. Well, this is all the advice I kind of have for you guys. I think another tip, I guess this will be counted as a bonus tip, I would say, is keep in touch with your classmates. That's something that's very important, because it's really rough out there in the nursing community. Nursing is a very rewarding job, but it's a very stressful job as well. And if you're new in the field, you kind of want to keep linked with people that kind of could relate. They're new as you. You guys could share stories, you know, comfort each other, make each other feel better. Like, it's very tough. It's a lot on you. There's a lot of pressure. You get it from everywhere. You get it from the patients, your manager, whoever. It's a whole big transition, and I would definitely say keep in touch with your classmate because, keep in touch with your classmate because it would definitely ease you into your career, make you enjoy it more. You have a support group and kind of just like help you love what you do. Like, you are doing a wonderful thing. You are definitely you will definitely feel rewarded towards the end of the day. So keep in touch. They make your life worth living. Not really. I just mean like they make it the career more rewarding because you get to share stories and meet up. Try to keep in touch. I'm not saying like call each other every day, but you know, keep in touch, ask questions, link up every now and then. Make sure everyone is feeling good, I guess. Be there for one another. Girl power or girl manpower, because there are male dishes too as well. I believe that's all for this video today. Thank you so much for watching. This is my first video, but I'll be putting a lot more content out there. Nursing, beauty, lifestyle, that's mainly what I will focus my channel on. I will post a video twice a week. I'm not too sure about the days yet, but I will definitely be more kind of fluent with this YouTube journey of mine, because I would love to document my nursing journey to becoming a pro. And thank you so much for watching again. Feel free to subscribe, like or dislike, whichever one floats your boat, and comment down below so we can start a discussion. Tell me about your experience post-graduation, and of course, have a wonderful day. I'll see you soon back in this channel.